As I've been mentioned, my name is Leshao Jeremiah Ole Kayioni. And the title of my study is Assessment of Prescription Practices at KAPENGURIA General County Referral Hospital, General Outpatient Clinics. I'm a hospital pharmacist at the same place, and currently pursuing a master's in epidemiology, that's epidemiology and pharmacovigilance from the University of Nairobi. So basically, what my study was trying to achieve is just to assess the issue of irrational use of drugs. And from the same, that's why I got the objective of my study, to try and describe the drug use practices at KAPENGURIA County Referral Hospital General Outpatient Clinics. So I'll move the next slide, please. So worldwide, the issue of irrational use of drug is a big problem, and more especially in developing countries like ours here in Kenya. There was a study done in 2002 by WHO that found out that approximately half of all patients who are prescribed medications, they end up misusing it. So what that does is that it has negative effects, which will include things to do with adverse drug reactions, increased cost of treatment, development of drug resistance, and wastage of scarce resources. So it's important that there's regular monitoring of drug use to try and avoid this issue of irrational use of drugs. And that's why WHO, in collaboration with the International Network for Rational Use of Drug, came up with the standardized guidelines to help us monitor this misuse. So with these guidelines, what it does is that it helps us to identify issues and try and implement strategies on how to curb this, to avoid these unsafe trends. Globally, studies that have been done are varied. It differs from one country to the other. But unfortunately, there are very few studies that were done in Kenya. So my study helps to fill this gap by evaluating prescription practices at KAPENGURIA County Referral Hospital. Next slide, please. So as I've mentioned before I got the methodology, the objective was just to assess prescription practices at KAPENGURIA County Referral Hospital. So, and from there, we'll have the specific objectives that are also covered. They are following the WHO en-route guidelines. So there are about 13 indicators that WHO tries to look at, and they are divided into 3. The prescribing indicators, we'll have the patient care indicators, and the facility-specific indicators. My study delves into 2 of those classifications, that is prescribing indicators as well as patient care indicators. Facility-specific indicators. I left out patient-specific indicators based on the nature of study as well as the ease of getting that information. So I deal with the prescribing indicators as well as facility-specific indicators. So methodology, study design, retrospective, descriptive cross-sectional study. The area is KAPENGURIA County Referral Hospital. Population of the study, all prescriptions from KAPENGURIA County Referral Hospital, General Outpatient Clinics, dispensed in the year 2022. How was data collected? So I customized the WHO en-route data abstraction form to be able to collect my data. And analysis, so the clean data and data cleaning and analyzation was done using Starter version 16, where continuous data was summarized in form of means and categorical data as frequency and proportions. So I also performed bivariate and multivariate logistic regression to be able to determine the factors that's associated with the antibiotic prescribing as well as polypharmacy. That was also one of the specific indicators that I was trying to do from my study. Next study, please. Next slide. So if we go to the results, if we look at the demographic characteristics of both the patients as well as the prescribers. So we start with the patients. So if you look at the adult population, they compose the majority at around 70%. And in terms of the gender of the patients, so female were more as expected. And then when you go to prescribers, the female prescribers were slightly more than the male counterparts. And when you go to prescriber qualification, the clinical officers were the majority. Next slide, please. So if you look at one of the prescribing indicators that I was trying to look, there are about 5 indicators that I was trying to assess. So the first one was on average number of drugs per patient encounter. So this is the average number that each prescription was having. So what I found out from KAPENGURIA County Referral Hospital is that the average around 2.7 per prescription. And this is way higher than the recommended, which should not be more than 2. We go to the second indicator, percentage of encounter with antibiotics being prescribed. It was very high at 84.1% compared to WHO optimal value of not more than 26.8%. We got the other indicator of percentage encounter with the injection being prescribed. It was at 8.7. These are within normal. And then percentage of drugs prescribed by generic name, it was at 97.6%, close to the target at 100%. And then the last indicator, percentage of drugs prescribed from the Kenya Essential Medicine List, it was at 95.6%, close to the target. Next slide, please. So I did also the logistic regression analysis, and what I presented here, the multivariate logistic regression. So from a few variables were of statistically significant. We look at the factors that were associated with antibiotic prescription. So patient gender played a role, and here the male patients had a slightly reduced incidence odds of being prescribed antibiotic compared to female at around 44%. They were reduced by around 44% compared to the females. The other factor that was of key to antibiotic prescription was the average number of drugs that was being prescribed. So for those who received more than 5 drugs, 5 or more, they had an odd of around 34% reduced odd of being prescribed an antibiotic compared to those who received less than 5 drugs per every prescription. And then those who not received an injection had about 83% reduced odd of being prescribed an antibiotic compared to those who received an injection. And then the last factor that was associated with antibiotic prescription was the prescriber qualification. And what I found that is that medical doctors, they had about 29% reduced odd of prescribing an antibiotic. So this, if you are to have an internal assessment of that, is that what happens that why the medical doctors, for example, are prescribing less antibiotics is that because most of the medical doctors, they were found in specialized clinics, so they were dealing with chronic illnesses. So more of their drugs were of this, the antidiabetics, antihypertensives, compared to them prescribing antibiotics. So if you look at polypharmacy, there were about 3 indicators that were associated with the polypharmacy. So polypharmacy here is prescribing more than 5 drugs by every prescription. So one was antibiotic, and the number of antibiotics being prescribed. So those who received an antibiotic were about 82% reduced odd of receiving more than 5 or more drugs in their prescriptions. So those who are receiving an injection as well, those who are not receiving an injection were 16.5 times more likely to have more drugs being prescribed. And then the last one was prescriber qualification also played a role. Medical doctors were 2 times more likely to prescribe 5 or more drugs in the prescription. Next slide, please. So a bit of comparison to other studies that were done in Kenya. So if you look at the first indicator on prescribing indicators, so the average number of drugs prescribed per patient encounter, so Kapenguria, as I've said, was at 2.7. The normal is, the normal optimal level is 1.6 to 1.8. So this was a bit on the lower side compared to Kisii and Bagathi, for the simple reason that if you could to compare Kisii and Kapenguria, Kisii is more of a remote area compared to Kisii, so maybe the issue of med reps were more. So being reminded that time is on my side. So, but that was what I found out. So the other indicators, like percentage of drugs prescribed by generic name, Kapenguria was doing okay. They were using more electronic compared to Kisii and Bagathi. The third indicator, percentage encounter with antibiotic, they were almost the same. Same with the rest. They're almost the same indicators. Next. So in conclusion, most of the prescribing indicators deviated from WHO standards. So two that I found out that were standing out was the average number of drugs being prescribed and the issue of antibiotic use. So that was an issue. There was a good adherence to generics and the prescribing from the Kenya Essential Medical List. The factors that were shaded with that were prescriber qualification, patient gender, the number of drugs per prescription, and the prescription types. So what we are learning is that there is urgent need to promote rational antibiotic use or general drug in use, and then educate providers and patients on antibiotic risks, implement essential drug lists, formation of medicine and therapeutic committees, as well as problem-based pharmacotherapy. Thank you. That's basically, I want to appreciate my supervisors who took me through this process, Dr. Eric Gwantai, Professor Oluka, and Professor Faith Okalebo, as well as Kapenguria County General Referral Hospital through the County Government of West Pokot. Thank you so much.